I am Professor Dr. Dharmesh H.S, practicing implantologist. I have made few videos based on the most frequently asked questions or queries about the implants. In this video, I'll explain why and when does a dental implant fail and how we treat periimplantitis. Periimplantitis is a destructive inflammatory process affecting the soft tissues and the hard tissues surrounding the dental implants. The soft tissue, that is the gums surrounding the implant, becomes inflamed. The hard tissue, that is the alveolar bone surrounding the implant, is gradually lost over time. In this video, we will address both soft and hard tissue problems and inform you on how we go about the treatment of each one of them. Mucositis, it is the inflammation of the soft tissue, that is the gums around the implant. How do we notice it? A. Bleeding of the gums. B. The redness and inflammation of the gums around the implant. How do we diagnose it? In the clinical examination, first we evaluate the general oral hygiene of the patient. Next is the examination of the tissues around the implant for the signs of inflammation, that is the change in color and swelling, followed by probing the tissue to ascertain if there is any bleeding on probing. Radiographic examination is done by taking an X-ray or scan of the implant and the surrounding structure, and it is checked for any bone loss. How do we treat it? We remove the crown or the bridge, check the crown if there are any rough surface that is attracting the plaque accumulation, clean it and smoothen the surface of or replace the crown if required. Check the soft tissue, that is the gums, and treat the gums by thorough cleaning and debridement. If required, soft tissue grafting is done. This is followed by prescription of antibiotics, and suitable mouth rinse and oral hygiene instructions will be given. Monitoring. After the treatment, the tissue is allowed to heal for a couple of days or weeks based on treatment, after which the same crown or different crown is fabricated and placed onto the implant, and you will be able to use it normally as before. Hard tissue is the alveolar bone loss around the implant. How do you notice it? 1. Pain. Next, swelling. Third, redness around the implant. Fourth is mobility of the tooth and the supporting implant may or may not be present. How do we diagnose it? By doing the clinical examination. First, we evaluate the general oral hygiene of the patient. Next, examination of the tissues around the implant for the signs of inflammation, that is the change in color and swelling, followed by probing the tissue using the periodontal probe to elicit if there is any pocket. Radiographic examination. X-ray or scan of the implant and the surrounding structure is taken and checked for any bone loss. How do we treat it? We remove the crown or bridge, followed by cleaning of the tissue around the implant and draining the infection. This is followed by surgery. Based on the nature of defect around the implant or the tooth, that is the bone loss around the tooth, the surgery is planned. It could be either a resection, that is removing some amount of bone in order to remove the infected bone, along with a part of normal bone to make sure thorough cleaning and disinfection of the area, followed by grafting based on the situation and requirement. Grafting is placing the artificial bone around the implant after thorough cleaning and debridement of the defective area, followed by closing with the soft tissue, that is the gums. This helps the patient to clean the area and keep it hygienic. Bone resection and grafting is followed by prescription of antibiotics and chlorhexidine mouthwash to enhance healing. Sometimes, very rarely, but unfortunately, in cases of severe infection and bone loss, leading to irreparable damage of both hard and soft tissues, the only treatment option would be to remove the implant. To summarize, the treatment of periimplantitis is thorough cleaning of the soft tissues, bone resection and bone grafting in case of alveolar bone resorption and a course of antibiotics. But it is always advisable to avoid periimplantitis by maintaining good oral hygiene by regular brushing and flossing. Not to forget, the regular follow-up will help us discover the problem quickly and treat it at the earliest stage. For more information, log into my YouTube channel, and you can also contact me on 9900008081. Please share these videos among your friends and family members to spread the right information about implants. Thank you.